Hello everyone, this is Dr. Ramya from Team MDS Conquer. In this video, we are going to discuss 32 important points from the topic of fractures. Point number 1. The fracture of tooth-bearing segment of mandible is compound fracture. Number 2. Most common complication of condylar injuries in children is ankylosis. Number 3. The fracture of mandible should be immobilized for an average of 6 weeks. Number 4. The displaced mandibular fracture in a child should be managed by early mobilization. Number 5. Resident wiring is indicated for symphysis fracture. Number 6. Fracture of mandible not involving the dental arch is treated by open reduction. Number 7. The splint which is most commonly used in dentulous mandibular fracture is cap splint. Number 8. The swelling behind the ear suggests fracture of condyle. Number 9. Direct impact on the bone will produce a transverse fracture. Number 10. The optimum length of screw for fixation of plate in mandible is 4 mm. Number 11. Hibernation is seen in non-union. Number 12. Direct interdental wiring is known as Gilmer's wiring. Number 13. Tenderness is the clinical sign that is always positive in bone fracture. Number 14. Battle sign is ecchymosis in the mastoid region. Number 15. Gunning splint are used when the patient is edentulous. Number 16. CSF rhinorrhea is found in nasoethmoidal fracture. Number 17. Urine fracture is maxillary fracture. Number 18. Bucket handle type of fracture is seen in edentulous patients. Number 19. In bucket handle displacement, fracture occurs on bilateral body. Number 20. External pterygoid muscle exerts its effect on condyle. Number 21. In subcondylar fracture, condyle moves in anteromedial direction. Number 22. Subcondylar fractures on protrusion of mandible deviates to same side. Number 23. Deviation to same side on protrusion is seen in hypoplasia of condyle, ankylosis and subcondylar fractures. Number 24. Uncomplicated fracture of parasymphysis mandible is best treated by closed reduction. Now let's see some uncomplicated pediatric fractures. Number 25. In uncomplicated pediatric fractures, open reduction and internal fixation is not indicated as it may damage the permanent tooth buds. Number 26. If fracture involves the dentate segment, occlusion acts as guide for reduction and hence circummandibular wiring with cap splint is treatment of choice. Number 27. If the fracture does not involve the dentate portion, the occlusion cannot act as a guide for the perfect reduction. So wait and watch with diet restriction is ideal option. Number 28. Zone of tension in mandibular angle region is situated at lower border of angle. Number 29. Zone of compression in symphysis region is located at lower border. Number 30. A displaced unfavorable fracture in the mandibular angle region is a potentially difficult fracture to treat because of distraction of fracture segments by muscle pull. Number 31. Ideal time period of immobilization of avulsed tooth is 7 to 10 days, whereas for immobilization of fractured mandible is 6 weeks. That's it for today's session, guys. All the points discussed in this video are very important from NEET and AIIMS point of view. So keep on revising them. All the best. Thank you.